this week's What's Going Around, we're talking about urinary tract infections, also known as cystitis, but more commonly known as bladder infections. Now, unfortunately, bladder infections tend to happen mostly in women. Very rarely do we see it in men, and that's because the bacteria that cause the infection in the bladder come from outside the body, rise up the urethra into the bladder and set up that infection. Now, this time of year, we have conditions that increase the risk of that. For instance, external irritation from prolonged swimming, wearing the bathing suits that aren't very breathable. You get more irritation, therefore more risk of infection in women that are prone to bladder infections, or oftentimes women that haven't ever had one before. Symptoms include burning and discomfort, frequency, and perhaps even blood in the urine. That's nothing to be alarmed by because the interior of the bladder is very fragile. That lining can bleed very easily when there's irritation and infection there. Now, this is a lower urinary tract infection. It's easily treated with antibiotics. An upper infection in the urinary tract would be a kidney infection, pyelonephritis, and that can cause some fairly severe symptoms: high fever, body aches, hard shaking, chills, nausea, vomiting, and can make you very sick. So if you just have that frequency and discomfort, get into the doctor, get into Centric Care. We can test the urine very quickly and determine if it's an infection, easily treated with an antibiotic. Now, there are over-the-counter medications available for urinary tract infections, but those are not antibiotics. They're just for the pain symptoms. They'll give you some temporary relief until you can get into the doctor and get on that antibiotic.